If I may, sir, let me put it this way po, kasi we were under the impression, I mean, I think that a lot of people are under the impression that that this move is being done para a balancing act between between health and the economy, so open up the economy a bit. From your perspective po, significant enough ba ang pagbubukas nitong ekonomiyang ito with this new move, with this new change in the system?
We don't think it is significant. I think we'll have to wait for it to evolve to bigger portion. The only thing that changed actually is the one who will decide whether you're 4, 3, 2, or what, or 5. Is the Department of Health. I understand, no? Mm-hmm. I don't know if that was done because IATF just want to put the onus. Because if you look at the classification, the one that can change the classification is the Department of Health. Why? They're the ones responsible for how many hospital rooms will be, how many doctors will there be, how many frontliners will be working. Unless they move and correct this, we will stay forever in the city of Manila. Do not expect that people are cooperating. So what else can we do?
Specifically, what do you want to see? More testing, more contact tracing, more isolation? Because you're saying, etong mga pagluluwag na to will not work unless the health capacities are increased. Specifically, what do you want to see?
Well, number one,
tayo dahan-dahan.
We want facilities improved. Hospital, COVID centers, isolation centers. We want them to. We are running out of medicines to improve that.
Yeah, so December.
Take care among others. Take care and pay the bills to the hospitals. Support the other government hospitals. Pay the doctors well. Pay the health the nurses, and I just exaggerate the situation. They're losing. A lot of them do not want to, the nurses. You offer 5,000 a day for 1 month, 150,000. You will have a lot of, they don't want to do that. Yeah, they don't want to do that. They're not doing it. Where are we spending our money? I was surprised before when we had the Sulong program, and I heard that they are using 255,000 for contact tracing. And then to sa Bayanihan 2, they asked for another 5 billion, and it was given to add 50,000 contact tracers. After 2 months, they said they need, it ran out, so they need another, for 18,000 contact tracers. I don't know if they got it. Now, and then eventually, what happened is even Dole is doing contact tracing. And yet, what did our contact tracing SAR said? I'm not happy with it. We're not really doing contact tracing. We're just doing it in the household. We're not really going out, and that is why even last year we already proposed. Why are we spending billions on this when the fact remains that you don't have to contact trace? If you're able to test enough, we're able to test only 60,000 when they say that to be really on the ball, it has to be at least 120,000. No? We should give that free. Like now, granular lockdown. No? Immediately, if there are cases in the area, rather than locking down the whole street, or the barangay, just this running a test the neighbors, and then isolate them, put them in, so that the government does not have to give ayuda, because the government cannot give ayuda anymore. Even the LGUs are already complaining that they cannot give. So, and another thing that we suggested was, why are we, frankly, I know a lot of people who got infected. I know some people, some relatives who died.
Yes.
Not even one of them can tell me that they were able to be reached by contact tracers.
Yeah.
So why are we throwing away millions? Ilagay mo yun sa hospital facilities, ilagay mo yun sa sa contact sa testing.
Testing.
Yeah.
Test important.
Yes.
You will not run out of people to test. You don't have to look for people to test. Because if you are give it, everybody will go there. And the other thing we're saying, why do you insist on, we have requested last year, we even wrote, many of us from the business, we wrote, at least for the contact tracing, no? Only for that, let's suspend the Data Privacy Act, especially now. Before, that might be difficult because there will be repercussion now on the people, but not anymore. Because we have so many friends, we have so many relatives who are infected, we are very sympathetic. Congressmen, senators, cabinet members, if they get infected, they say it so that people will go, we reverse the process.